on numbers, answer a few questions, and then we have one or two topics to cover. Worldwide, almost like 1.8 million cases in the United States, over 550,000. In Alabama, when this report was written this morning, Alabama was reporting 3,611 confirmed cases with 95 deaths, and 61 of those being classified as died with COVID illness. In Mobile County, when I last checked the ADPH real-time dashboard, they were showing 468 confirmed COVID patients and Mobile residents, with 18 reported deaths and 9 died from illness. We've been stuck on 9 died with illness for a couple of days. Just to remind you, it does take some time during our investigation for us to obtain the medical records and make those available to Montgomery so that the medical officers working at the state health department can classify a death as died with illness. So we do expect the number of died with illness to go up for Mobile County. Also, I hinted at last week, that the state may be changing the way they report deaths. I thought that might happen today, but it's not. So later in the week, you may hear some more information about that. So also in our daily report, our health officer for Mobile County, Dr. Bert Eishold, commented that in the 24 hours between April 12th at 8 a.m. and April 13th, 8 a.m., there were around almost 350 additional cases reported for Alabama. We saw over the weekend a modest uptick in the number of cases, around 10% over a day. Some of that is attributed to the closing of laboratories on Easter Sunday. The state lab was closed mostly because of the bad weather, the threatening weather, but we expect that we may see another dramatic jump in cases now that the lab is back open today and running on a normal schedule. So we still have, statewide stay-at-home order. We're still restricting gatherings to no more than 10 people, and only when you can preserve that 6-foot physical distance from someplace else. And on Friday, I mentioned that we knew people would be tempted to go out and about on the weekend and move in about the retail establishments, and we tried to warn our retailers and their customers, our friends and family, that it was still really, really important to stay at home when you can, only go out for essential items or for medical visits, and stay out of retail spaces to the extent possible. And people had a hard time doing that over the weekend. We have lots of reports of large gatherings of folks, lots of people in the grocery stores and the big box stores and in the little stores. And I can't implore enough how important it is not to do that. Because if we continue to violate those public health orders, we're going to run the risk of losing the privilege at all. So please only go out into the retail areas if you absolutely need to. Reduce the number of times that you have to go, order pickup or curbside, order delivery, groceries if you can get an appointment, pick them up curbside when you can't, and send one family member to the store if you have to go into a retail facility for groceries or for pharmaceutical supplies or for medical supplies. We all need to play our part. And again, staying at home does not mean block party or sleepover or family reunion. It means you stay at home with just your immediate family members. And if you go to a drive-up church or to, a drive-up, we're hearing maybe there might be a drive-up movie, who knows, might come back in vogue. But stay in your cars and don't congregate with people who are in their cars. Stay in your car and don't violate those public health orders when you're out and about. The other thing that I've been asked to comment on is the proper wearing of a face covering. This cloth is a face covering. This is a face mask. These are the kinds of supplies that we want to preserve for hospitals and healthcare and our first responders. We would prefer not to see these on people out in the community because it means that you're wearing a mask that could potentially be a life-saving material for our first responders and our healthcare workers. If you do wear this mask, one side has a piece of metal, or it feels a little stiff in there, some sort of fabric. When you put this on, the top is the part that goes across your nose. Then you scoop your ears, and this entire piece needs to come under your chin. So the proper wearing of this face mask is to pinch at the nose, cover the full nose, and cover to under the chin so that your full mouth is covered. This will protect other people from germs that you might cough or sneeze out, because it will limit the distance that those aerosols can travel. So this is the proper wearing of a face mask, okay? Not this or this, or over your mouth and not your nose. These are all improper wearing of a face mask. So a face covering, this is one that one of my coworkers made. I think Holly down in X-Ray made this. So thank you, Holly, for helping us out. We don it the same way. If you put it on, it just goes around my ears. You won't be able to hear me as well because this is a thicker material. But I'm going to pull the top over my nose and pull the bottom under my chin. Okay? This is the proper wearing of a face covering. Again, not this. This is not helping. Might be helping what's coming out of your mouth, but you still sneeze and have aerosol out of your nose. And also make sure that you get around the bottom of your chin. Okay, got it? Are we all cool? All right. So having gotten that out of the way, let me answer some questions that have come in. One is, we get a lot of questions about the antibody test that has been used by the city and some counties for their first responders, where you may have heard that several hundred first responders were tested using the antibody test, and lots of people have asked, what is it? Where can I get it? What's it used for? And it's very quick, it's easy to perform, it's like a rapid strep test. You can do it at what we call the point of care, or in a doctor's office, or almost anywhere. However, it has limitations. There are some good documents out there that we have referenced to make sure that we're helping folks understand how and when and how an antibody test might be useful. And FDA has reminded folks that the antibody tests, and again, when your body is, when a virus is introduced into your body, your immune system produces cells that help fight off that infection, and those cells are called antibodies. So the antibody test should not be used as the sole basis for a diagnosis of COVID-19. If the antibody test is positive, you would still need a positive PCR test to determine if you have active infection. The antibody test means that you have been exposed to coronavirus some point, in the recent future. The difficulty of the antibody test that's been used is it doesn't necessarily only detect antibodies to the new coronavirus. It might also detect antibodies to the common cold coronaviruses that circulate each year. So we can't even say for sure that your positive test is due to a recent infection. It may be due to a common cold coronavirus that your body tried to fight off in the fall, or maybe even last year. So while it is helpful information to know, and it's quick and easy and can be done on a large number of people, it still doesn't answer all of our questions about who has coronavirus, who might be shedding virus, and who might be immune from another infection. So just stay tuned on that. We have conversations almost daily on how we might be able to put that antibody test to use to help us make some decisions as we continue to receive more and new information about the coronavirus. Another question about, there's been another report, I believe this one was out of China, about the virus that causes coronavirus or COVID-19, that it may linger on tiny respiratory droplets or in the air for longer than suspected, or it might travel longer distances than previously thought. And there are several studies that support the idea that the virus that causes COVID-19 may linger in air or on respiratory droplets or in what's called a gaseous cloud, which is expelled during a cough or sneeze. So when you sneeze or cough or talk really loudly or sing loudly, you are more prone to release these respiratory droplets, and some droplets may contain virus that can infect others. That's the reason for the recommendation for wearing the facial mask, so that you limit that spread and you don't, and you protect others from the germs that you may be carrying. And also, we have learned that we may have people who are infectious or contagious to others, but they're not showing any symptoms, or they have not begun to show symptoms yet. So all of these things, the virus lasting longer in the air than thought, it traveling further distances than we originally thought, asymptomatic infection, pre-symptomatic infection, all of these things are some of the reasons behind CDC's recommendation that everyone wear a face covering. And remember, try to wash this every day if you can. That would be a best practice. All right, also the virus can live on surfaces, and that's why we tell you to wash your hands. If I am here and expel respiratory droplets from a cough or sneeze and I walk away, if someone else came to this lectern and touched it, they could get live virus on their hand, and then if they touch their face, their mouth, nose, or eyes, that's how they would infect themselves. So if I touch a contaminated surface where the virus is living, and then I put my hands in my face, I have infected myself. So that's the reason we try to get you to wash your hands and disinfect contact surfaces as often as you can to try to reduce those modes of transmission. I want to talk just a little bit about data and information. If you have not visited the daily dashboard, the real-time dashboard at alabamapublichealth.gov, please go there and take a look. They are adding information on the number of patients with laboratory confirmed COVID-19 every day. And as they are doing that, we're starting to learn more and more about what's going on in Mobile, how we're comparing to the rest of the state, those sorts of things. I've had a couple of media inquiries about how we compare to Jefferson and that sort of thing. So in addition to information on the number of cases, the testing facilities, there are also characteristics there about race, age group, ethnicity. There's information there on, if the COVID positive cases were healthcare workers or if they worked, resided, or visited a long-term care facility. And there's also information there today, this was new for me, I was very excited to see this, on the rate of disease by county. And what this means is think of it as a per capita statistic. So we take the total number of cases reported in a county and divide that by the total number of people living in the county, and that gives us what we call a rate. And the rate for Mobile County right now is 110 cases of COVID-19 per 100,000 people. And that is slightly lower, just in the same ballpark as what Jefferson County is seeing. So we are not necessarily seeing more cases than Jefferson right now. It looks about the same. There are some areas of the state, this is what the map looks like when you go online. This is the one I printed, so it's not very good. But you can see there are some geographic areas in rural counties where the per capita rate of COVID-19 is much higher than what we are experiencing here in Mobile County. So take a look at that. The state is trying to understand the reasons behind that, and as they learn more, they will certainly tell us. What we have begun doing is giving a qualitative measure of the number of cases by zip code in Mobile County. So we are restricted from the HIPAA privacy rule in providing the number of cases for any zip code that has less than 20,000 people. But we produced this map to give you an idea about the density of cases in the zip codes around the county. So white means there are 0 cases in that zip code, and then the dark blue mean those zip codes have more than 20 cases. So this will give you an idea about where the cases are occurring around the county at a more, on a level less than the 5 or so zip codes that we're reporting to you publicly each day. So I just wanted to make a note that we are starting to share that information with you publicly daily, and we are committed to continuing to provide information as we learn more about the data. So that ends my list of remarks that I wanted to make today. James is here helping today with questions and with Facebook Live. Are there any questions, James?
You just answered the one from Friday, which was why we can't discuss we can give the first 3 numbers of the zip code, but not the last 2.
Right. That is the determination that our attorneys and compliance officer here worked with the state of Alabama, state epidemiologist, and attorneys there to negotiate those terms to really take the privacy rule and determine the greatest extent that we could share information while not violating the privacy rule and accidentally revealing someone's identity. So we have to only report data at the first 3 digits of the zip code for zip codes that have less than 20,000 people population. That's why we have grouped all of the 365s and the 366s that have less than 20,000 people in them.
The other question was, can you quickly say where to find the instructions to make the face covering?
Yes, there are really good instructions on the CDC website, and I'll show you where that link is, James, so that you can post it on Facebook. They have a video that the Surgeon General, Jerome Adams, has produced that shows how to make a face covering with just 2 rubber bands and a square piece of cloth cut out of a t-shirt. So that is very simple to do, and it is a great option. And there are also materials there that can show you how to cut, out of fabric using, what is it called?
Handkerchief?
Yes, you can use a handkerchief or a piece of fabric. I'm thinking about, if you have the stretchy materials. Hope is going to be mortified when she sees this. So if you have the elastic, sorry, I'm not a seamstress, obviously, and a pattern, that's the word I was trying to come up with. If you have a pattern, then you can make these sort of nicer ones. There's also all kinds of YouTube videos out there about making your own face covering, and we really encourage you. And if you're nifty at it and you're talented and want to produce a bunch, I'm sure that your neighbors or your school parents or friends or churches would be very happy to receive some of those, or maybe even purchase them from you. Any other questions?
Quickly, if you could remind everyone about the curfews and the stay-at-home order.
Right. So remember, the stay-at-home order is in place for all of Alabama through the 30th of April, and it applies to every non-essential worker. And there is a list of what is considered a rather long list of what's considered essential, mostly health care, public services, public works, government agencies, grocery stores, pharmacies, those sorts of things. So you are to remain at home. And there is a curfew in the city of Mobile between the hours of 10 p.m. and 5 a.m. So that means you stay at home unless you have to go out for milk and bread or a health care visit or to check on a family member. But if you do that, it shouldn't be the whole gang in the car traveling around the county. It should be one family member, preferably, to go into those retail spaces. At this time, it's really important that we continue to reach out to our neighbors and to our extended family members and to our populations that have been sheltering in place for a really long time, who are in some of those high-risk groups. So call them, Skype with them, send them a letter, maybe a card, to let them know that you're thinking about them, because being isolated doesn't mean that we have to feel isolated. We still want neighbors to talk across the yard with people, that sort of thing. But there are absolutely no gatherings of 10 or more people, or any gathering where you cannot maintain a 6-foot physical distance from everyone else in the room.
That's it.
Okay, and with that, we will see you here again tomorrow at 2:30. Have a great day, everyone.
Thanks for joining us here on Fox 10 News. I'm Chelsea Sayasan. Now, we just heard from Dr. Rendy Murphy with the Mobile County Health Department. She explained that from April 12th to April 13th, that's today, the number of cases in Alabama went up by about 350. That's about 10%. Now, they said this is probably due to a lot of labs being closed on Easter Sunday because of that severe weather. She also showed us how to properly wear a face mask and face covering. Dr. Murphy said that there are 9 confirmed deaths related to coronavirus in Mobile, and she expects that to increase. Now, you can watch this full video on our Facebook page. That's Fox 10 News. I'm Chelsea Sayasan. Stay close because we'll be right back with Mobile Mayor Sandy Stimpson at 3 p.m.